All right, welcome to Dental Board's exams reviews. So this is Dental Implantology review series number 3. So this is a series of basics in implants for your NBDA exam. All right, and if you haven't reviewed the first and second series, make sure you watch them. Okay, all right, and also subscribe so you can receive the notifications for the upcoming series. So, question number 18. What is another term for osseointegration? Okay, so you're supposed to know this one. Is it functional ankylosis, micro interlock, both of the above, or none of the above? Okay, so this you're supposed to know. So, both of the above, both functional ankylosis and micro interlock are the other terms for osseointegration. So, our answer is C. All right. So osseointegration, the definition is that with it, when the implant is osseointegrated, the bone is intimate, but not outer structural contact with implant. All right. So this is important point here. So the bone is in intimate contact with the implant, however, not at ultrastructural level. Okay. You're supposed to know this. This is a high yield point. All right. And how about the interface surface of the implant? What does it consist of? So the implant interface consists of one, the amorphous layer, which is formed between the implant and the bone, uh, and then lamina limitans between the mineralized bone and the amorphous layer. So you have to know the sequence. Okay, make sure you know and memorize the sequence. All right, and then afterwards there comes a layer. Okay, so a layer of titanium oxide and titanium phosphate calcium complex with our proteoglycans. All right, and the other terms, as we discussed, functional ankylosis and micro interlock. All right, so high yield slide here that you're supposed to know. All right, so question number 19. Which of the following best describes the peri-implant soft tissue? So you have to know the architecture or the arrangement of the peri-implant soft tissue. If you're going to put implants in a patient, you're supposed to know how they work, okay, and the architecture of the soft tissue around it. So, is it that collagen fibers run perpendicular to the implant? B, the tissues is highly vascular. C, the tissue contains fewer fibroblasts than observed in the normal periodontium. Or D, the gingival sulcus will provide more resistance to clinical probing than the normal periodontium. So our answer is C. Okay. The peri-implant soft tissue contains fewer fibroblasts than in normal periodontium. So you're supposed to know this, okay? All right, so a quick feedback. The biological width associated with an implant, all right, is greater than the biological width associated with natural tooth, all right? And the peri-implant mucosa connective tissue shows decreased, all right? So there is decreased vascularization found next to the implant, all right? Just apical to the junctional epithelium. All right, so you have to know that there is decreased vascularization. All right, another point you supposed this is high yield stuff that you're supposed to know. Another point that you need to know: the composition of the connective tissue associated with the implants shows difference of the mucosa around the teeth, in that there is an increase in collagen fibers, a decrease. This is one of the questions that we just answered. A decrease in fibroblasts and a decrease in residual tissues. Okay, all right. And the other differences in peri-implant mucosa is that clinician may find less, okay, less resistance to perioprobing when you compare to natural teeth. All right. And also clinical probing depth is higher around implants versus teeth, natural teeth. All right. And as the tip of the probe ends apically to the junctional epithelium into the connective tissue close to the crest of the bone. All right. So therefore, this is important because when you do bleeding on probing, when you're probing and you see some bleeding, you're like, oh, gingivitis. Okay. However, bleeding on probing is more reliable sign of inflammation on natural teeth than it is on implants. So remember that fact. Okay. All right. Question number 20. All right. So primary stability. So if you're going to put implants, you have to always think, okay, can I achieve primary stability on this implant? If not, what's my plan? Right? So primary stability for immediate implant loading is how much torque, okay? Less than 35, more than 35, more than 20, or less than 20, okay? So if you said B, more than 20, more than 35 newtons per centimeter, that is correct. All right, so make sure you know this number here. So question number 21, a dentist is placing 2 implants to replace missing teeth. Okay, 28 and 29. So the premolars on the right side in the mandible are missing. What is the minimum required mesiodistal? So anterior, so this is a mesiodistal, so anterior posterior width of edentular space that she needs to place 2 implants. So 2 implants with 3.5 millimeter platform. Okay, so let's do some calculation. So you have your mandible here, and you have, so 28 and 29 are missing. So you have your tooth number 30. Okay. So this is number 30. And so those 2 are missing. So that means these are the canine. Okay, so you have our mandibular canine. All right. Okay. So what is the distance? How much distance do you need to put 2 implants, which are 0.5 millimeters in diameter? Okay, so 2 implants. So you're supposed to put 2 implants. Okay, so this 1 implant. Okay, this is another implant. So each implant is 3.5. Okay, so if we are going to put 2, so plus 3.5, that gives us 7 millimeters just for the implants themselves. Okay, so that means these answers which are 7 millimeters are out. Okay, because we're already at 7 millimeters now. For the implant distance, from the natural tooth, this distance here, okay, is supposed to be at least 1.5 millimeters. Okay, that distance. So that means we have to add 1.5 millimeters. How about this implant here? So this implant also from the natural tooth supposed to be placed at 1.5 millimeters. Add another 1.5 millimeters. Okay, so now we have what? We have 3, so we have 10 millimeters. Okay, so we still have those, the A and B, okay, because we're still at 10. So now, how about the implant to implant? So these questions shows if you understand the measurements or the amount of space you need to place an implant. How about the in between? The minimum distance you can place implants, okay? So implant to implant distance, the minimum is 3 millimeters, okay? So plus 3 millimeters, which gives us 13 millimeters, okay? So make sure you understand this principle, okay? All right, so our answer is going to be B. All right, B is our answer. All right, question 22. The first bone that is formed near the implant is histologically categorized as, oh, this is a good question that you're supposed to know. Okay, is it A, woven bone, B, trabecular bone, C, lamellar bone, D, contact bone? Okay, so if you say A, woven bone, that is correct. So the first bone that is formed near the implant, okay, is woven bone. And these are the 6 stages of osseointegration that you're supposed to know. All right, number 1 is the formation of the clot. So once you put an implant, there's bleeding. So the bleeding going to form a clot, okay? And then there's necrosis of the surface bone cells. All right. Number 2 is inflammatory response. Okay. That usually lasts about 2 to 3 days, with fibrin strand ingrowth onto the implant. And then after 3 days, about 4 days, you have angiogenesis. Okay, that's the third. Okay, the third stage is angiogenesis. You need that blood supply to bring in the nutrients. You bring in the nutrients, then the cells start to grow, and then there's new bone formation. And okay, and you're also bringing some other stem cells in the area. All right. And number 4, osteoprogenitor cell migrate. Okay. And then, so they are migrating after the angiogenesis. And then number 5, you have formation of the osteoid matrix, which is the woven bone, okay, near the implant. And number 6, you have formation of lamellar bone through remodeling. So formation of lamellar bone is the goal, whereby you achieve the osseointegration. Okay, make sure you know that. All right, so coming up next is dental implantology review series number 4. Make sure you subscribe so that you can receive notification of the new videos. If you have any questions, okay, please comment or email me. All right, good luck and keep studying hard. You can do it.